The final pharmacy clerkship would be the core competency testing platform to see if they could actually hit all the targets. In the clerkship setting, there's a real patient sitting there. There are actually real doctors and nurses actually seeking your input, as a pharmacist. So each of the students will have their own patient. So they would actually have a real hand-on experience, to apply what they have learned throughout the 4 years in that particular case or daily activities in the hospital. The way I designed hospital pharmacy clerkship is to equip the students in several areas. We have 4 components in our assessment. One is actually the literature evaluation, drug information skill, and also oral and written communication skill. One component is actually evaluate the ability for the students to evaluate how they could update their clinical knowledge based on the literature evaluation. So they have to actually critique some of the medical journals, because some of the management already changed when they are in class as a student, so they have to know what is actually out there to prepare the best management for the patients. The other one is actually drug information training, because they have to know how to actually adjust those drug information questions, not just to the physician, but it could be to the patient or carers or family members in the future. The other skill that we want to actually equip our students is actually to prepare their communication skill, both in written communication skill and oral communication skill. When we actually train up our students, they would have to know how to communicate to the other healthcare professionals, addressing the potential drug-related problems they have to write. The other skill is actually the oral communication skill, because they have to disseminate the information or the assessment to the particular stakeholders. So the stakeholders could be healthcare professionals, nurses, doctors, dietitians, respiratory therapists, or to the carers or patients in a layman's terms. And then at the end of the day, they said, I know why I have to study that particular lecture now, and because I have seen this patient in the real world that with this type of problem. I do understand why you're teaching me now.